From the News Channel 5 Network, this is Open Line.
Happy Monday and good evening to you. I'm Carrie Sharp here for Open Line tonight. We are just about a week away from the start of school. Can you believe it? Summer is almost over, at least when it comes to school time. And that means a lot of folks have to get back in the routine of getting to school and maybe have to deal with a little bit of anxiety that comes with it. And I've got a great guest here with me to help us through that anxiety, Dr. Edwina Chappell. And I'm going to have to look down to get this full title, but you're with the Department of Mental Health and Substance Abuse Services.
Yes.
That's a mouthful.
Yes, it is.
Thank you for being here.
I'm glad to be here.
She's a little bit of a reluctant guest. I told her we'd be really nice to her because you have some great information for us. Because this time of year, we're just about a week out, it comes with a lot of change, a lot of newness, and that can stir up a lot of feelings inside of a lot of people, doesn't it?
Yes, it does. And typically, you think of school time, and there is the excitement that you expect with that. But on the other hand, there are some things when you talk about the newness and the transitions and new friends and new bus routes and new teachers, different things like that, that can be a little scary and make people feel a little uncomfortable and create some anxiety. I mentioned to you earlier, I think, and I guess I might as well say this, that I was talking, to you about, the anxiety and what they are probably feeling like, and they probably feel kind of like me right now.
As you were preparing for the show, you're like, wow, I feel kind of anxious.
Yes, I did, because it was new. It's a new experience for me, and so now I can, actually can be in touch with what the students are going through right now as they prepare for this new school year.
And I want to invite everybody who may be sitting at home that this is your time to call in, whether you're a parent with a student that may have some anxiety, or maybe you're the parent with anxiety. I'm kind of in that boat, as I was telling Dr. Chappell, that I'm releasing my child, my little 3-year-old, into the world in just about 2 weeks to go to preschool for the first time. And I'm anxious about it, but I also don't want that to spill over on him. So we're trying to be very excited in our house and talk about it, but inside I am nervous about this. So I'm sure that some of you are the same way. If you have any questions tonight, go ahead and call in. The lines are open right now, so you can get through pretty easily. Numbers on your screen, 615-737-PLUS or 7587. Lines are going to be open for the next hour, so go ahead and give us a call. In the meantime, I want to start talking about, we're a week out. We can't turn back time and think about what we should have been doing earlier this summer, but we're about a week out from school starting. What can we do from this time forward until that bell rings to get our kids prepared?
Well, certainly parents can just start trying to do those things that will prepare the young people for this newness. For some, it's going to be a matter of, do you have your school supplies? And, just making sure that they've made the right contacts. If they haven't done that right away, then, or they don't know how to do that, then they might want to call the school or the school board and try to identify where those places are. I think some of the retailers probably have lists and that kind of thing that will help facilitate that for parents. So that would be one thing that they can do. And just talking for some children, of course, it's going to be maybe I'm returning to the same school, but it'll be a different teacher. So maybe it won't be quite as stressful for them. But for those who may be making the complete transition, like a child who's moving from, say, pre-K or maybe kindergarten, into first grade for the first time. That's a brand new school, or moving from elementary into middle school or middle into high school. That can be something, that's pretty uncomfortable, and especially if they've had the same friends all through those 4 years or those 3 years where they were before, and now they've got to make a whole new set of friends. But just kind of sitting down and and talking to the young person and and I want to say more than communicate, really kind of communicating with that young person so that they're really hearing, and the young person knows that they're listening, especially for the older ones, but even for the little ones. And there are lots of little things that they could do, maybe even a little color sheet or something like that, just say, well, tell me how, or show me how you're feeling, you know, about preparing for school and stuff. And because sometimes the little ones don't have as much of a vocabulary to be able to really tell you, oh, I'm scared, or that I'm really uncomfortable, could you help?
Right.
But they can show us sometimes in their, their pictures, and and we can kind of take a look and go over that with them, and and kind of talk about what those feelings are like, and kind of help walk them through, and give them some ideas. Well, how do you think you might respond if kind of maybe set up a few little situations? Yes.
Yeah.
Yes.
I caught myself the other day. My son wasn't using his please and thank yous, and I said, if you do that at school, if you don't use them at school, you may get in trouble. And I thought, oh gosh, well, I don't want to scare him, So I thought maybe this isn't the proper tactic, and then he's gonna be scared to go to school. So it was kind of like a slap on the hand for the mom right there. But I thought, well, gosh, but I want him to go to his teachers and look like he has manners.
I know. And we try to give them everything that we can. Although I think one of the things that we have to remember, and we're anxious.
Yes, I'm nervous.
Ourselves, like you were mentioning how anxious you were about your little one getting ready to go off to school, and when we do that, sometimes we want to try to make sure they've got everything already. So I've got this piece covered, and I've got that piece covered, and so forth and so on. But we won't necessarily be able to, take care of everything, at least not in a day,
right?
Kind of a thing. So just kind of take a lead, and you did stay calm, so that was a good thing. So you're handling it very, very well, and so he's seeing you as the role model, and mom's not really too
freaking
anxious.
out.
That kind of thing. So I think this thing might be okay.
I'm thinking about the first morning. Everyone likes to take pictures on the first day, and it's a big morning, and I'm sure the schedule's a little crazy. You're getting up early, you're getting breakfast, you're rushing to get out the door, or meet the school bus. How much should you just try to make that kind of a normal morning as much as you can, so there's not that heightened level of anxiety? Is it possible?
You try.
I don't know.
You try, but sometimes they handle it much better than we do. Kids are really great people. They really are, and so some things that we think are really going to just set them off, or send them into some really high level of stress. It's just a piece of cake for them, right? So again, that's something that we can kind of talk to them about, is that kind of activity may go on as part of the school day, because we all want to see you go and on the first day of school, and we want to remember this, and we want to have this in our video so we can go back and look and see that, oh, there he is, and it just, and we can smile and put our chest out, and then he can see that we were there. So again, just preparing the young person so that he or she knows, okay, well, we may do this, but really, this is probably something that you've done in other events, right?
True,
in terms of other things that he may have been able to accomplish. Maybe his first trip to some water park, or or something like that, and you were
snapping pictures along the way.
So he's kind of familiar with some of that, but just letting him know that, and I think he will be very, very pleased to know that you all are there and you all are cared, and he's gonna.
I hope they're probably like, go, Mom. Okay, I'm good. See you later. Even at 3.
Then you'll probably be the one like, oh, he's not gonna miss me.
What? You're probably exactly right. We have a lot to talk about in the next hour. We're talking about anxiety, the small stuff, but also when it gets bigger into actual anxiety disorders. So stick around. Lots to talk about. Feel free to call in as well. We'd love to hear from you. Stick around. Welcome back to Open Line tonight. We are talking about easing that back-to-school anxiety, both for the student and perhaps the parent. I know I have a little anxiety, but we're going to work through it over the next hour. Feel free to call in if you have questions and would like to hear the advice of Dr. Edwina Chappell from the Tennessee Department of Mental Health and Substance Abuse Services. She is here to hopefully answer your questions. We've talked about dealing with normal anxiety, getting in the routine, kind of setting the expectations, talking to your kids in advance of what things are going to be like, really listening to them. How do you know when things go from just having normal anxiety, which we all experience, to something that may be more serious?
Well, often what happens is it kind of takes over the person's life, so that there are things that they're not able to accomplish. I'm trying to give an example of, say, someone who may have a social anxiety, and they, tend to like shy away. They don't really want to do much speaking. Say they might have a part, and maybe you've seen them at home, and they are really, really great at the, but then when they get to school, it's they don't want to have anything to do with that, and then they just pull back, and a lot of times they just totally avoid it, and it gets in the way, so that they can't reach their full potential because that anxiety is really just kind of, causing them so much stress. And sometimes, though, too, what also happens is not only does it cause the young person a lot of stress, but then the parents are kind of at their wits' end too, and so it's causing them tremendous stress. For example, like separation anxiety. I was thinking about something like that, where you have the little ones or whatever, and you're talking about dropping your young person off for preschool. And so sometimes, parents get ready to do that. Well, what if now it sounds like that your person is going to be really eager to get out. He's going to be eager to get out. He's going to say, "Have a great day, Mom. I'll see you this afternoon." Or but then there are some young people that parents get ready to drop them off, and they're not budging.
No, you got to like push them into the classroom.
They are not budging out of that car, and it becomes temper tantrums, and it becomes quite an event. And of course, it can get so bad that it actually starts to interfere with the parent's ability to be able to continue to, parent in an appropriate way, because he or she may end up, being late for work and that kind of thing, which could then impact whether or not he or she might have a job later on. And so it starts to put a stress and strain on everybody. So, when things just get so, out of control, such that, then people might want to think about seeking out, some help for the particular anxiety disorder. The other thing is, too, I think sometimes, a lot of people don't think anxiety, because sometimes there's a lot of distraction associated with anxiety disorder. So, the first thing people may think about is like ADHD, for example, because you've got all that inattention. But sometimes it's really the anxiety that's really got them so distracted, so unable to be able to focus, and that kind of thing. And
how do you determine that?
If you go to a mental behavioral health professional, that's the politically correct term now, then typically somebody is probably going to do some kind of assessments and that kind of thing, but they also want to look at patterns, so you are not just looking at one isolated event, that kind of thing, because it could be something just like in my case tonight, you're anxious because of one particular situation, but overall
you're
things are okay. But you will look to see, if this is something that's occurring, is it like a specific situation that's creating the anxiety, in which case, you may want to talk to the school staff and so forth, and kind of find out, what might be going on, what might be triggering. And actually, that's really kind of a good thing anyway, so the more data that you have, the more input that you have, and even for the behavioral health professional, the more input that he or she has, then the better able that they are able to kind of pinpoint, well, that sounds more like this sort of anxiety situation, as opposed to that. And then there are also some assessment tools, some objective tools that might be used for that. And often, like in mild cases of anxiety disorder, then the behavioral health professional may recommend a behavioral therapy. Usually it's kind of a cognitive therapy where there's a lot of like self-talk, because what happens, and I can really kind of relate to that, is those thoughts really kind of get to your head, because I was just thinking about, some of the anxiousness that I was feeling coming on today, and then I had to keep telling myself it's gonna be okay, it's gonna be, and you go and your child goes, because I was thinking, I said, this is what the children are going to feel like as well. It takes them sometimes to the worst case scenario.
It's all that runs through your head.
I'll never do it. And it's really not going to be that bad. I mean, this too should, but in their minds, there is no logic. Right. There is no rationality about anything going on here. And, so you really just have to, kind of work with them and help them, to kind of get through some of the things so that they can kind of calm them down. And as parents like you were very patient, with your young person. But that's the thing, and it does sometimes. It takes a lot of patience, because sometimes we don't understand what you do it at home, and so when things happen at school that kind of interfere. Why test anxiety?
I want to talk about that.
Okay,
that
that kind of thing.
Let's get to Jane. She's on the line real quick before we get to more about testing anxiety. Jane, thank you for calling in.
Hi. Well, actually, you were just about to answer my point. I was calling to talk about testing anxiety. I mean, I've seen it from high school, and I just want to know, does it begin in younger ages too, or because then standardized testing is a big thing for little ones, and so I just kind of wondered, what are some ways to help my kids with that?
Great question, Jane. I'm gonna put you on hold, so listen to your TV, okay? All right, go ahead. So testing anxiety, when does it usually start, and then what can we do?
Okay, well, for many young people, it just kind of starts, and it can start in early, elementary school, that kind of thing. And what the children start doing, they put a lot of pressure on themselves, and I want to be perfect, and and so forth, and I've got to get it right, and there's so much going on about this test that they're going to have that they just can't say. And sometimes what may happen is, and we have to remember, I don't know how many parents or maybe helping the young person to start early in preparation, for example, for the test. Sometimes we find that it's about cramming. Do you remember those times when maybe you were in school and then you were getting ready to take the exam, and you just knew you were ready because you studied all night the previous night before, and then you got in the examination room or in time for the test, and what happened?
Blank.
Complete blank. You couldn't remember a thing. And you were about to
die.
Yes. Okay. And so some of that, we can help like with study, because we try to cram everything in the, and so the young person is not doing as good of a job in storing that particular information and organizing that information in his or her brain. So what we may want to encourage is like smaller chunks over a period of time. So if for example, there's going to be an exam, or like a spelling exam, for example, on Friday, then you don't want to wait until Thursday to be able to try to get all those words together. So you kind of review, little pieces at a time as you build up, and so then you do a better job of organizing that particular information. The other thing sometimes is that has to do with like strategy. Sometimes the test might have time limits, and so while the young person may know the information that needs to go there, he or she did not pace him or herself appropriately. And so as a result, then did not do as well as he or she could, and of course they're devastated as a result of that. So kind of helping them learn, talking about the format of the test. If there's a way to kind of know that ahead of time, if you're going to have multiple choice versus open-ended kinds of questions, that kind of thing, that may help the young person in being able to, better prepare. If they get to questions sometimes too, that, well, I don't know these, and then they think, I won't know anything on it. But it may not be that every question is like that. So, when they get to some questions, then just kind of read down, skip over, and move through some other questions. And sometimes, to their surprise, they find, I know the answer to this one.
You can boost that confidence level back up to go back.
And so they are feeling much stronger and better about the exam and their ability to be able to do a good job.
Great tips, great tips. Okay, we're going to take another quick break. When we come back, more of your questions if you have them, more about talking about easing that back to school anxiety. Stick around. Welcome back to Open Line. We are talking about easing back to school anxiety. If you have a question, whether it relates to your student, your child, or yourself, go ahead and give us a call. The number is 615-737-PLUS. Love to hear from you. Dr. Edwina Chappell here with me, and we were just talking during the break, and this is really heartbreaking. 80% of children not diagnosed who have anxiety disorders. 80%? Why?
Well, and we kind of mentioned many times people kind of overlook the fact that treating anxiety disorders is really something that needs to happen, so they don't ask for that kind of help. And like a lot of other behavioral health disorders, then they just go kind of under the radar. But the longer, as with most things, the longer that they stay untreated, then actually they can just spin off into something even much worse. The other thing that we talked about is that people may not think about anxiety disorder because some of the behaviors look like ADHD. And we also kind of mentioned during the break that sometimes the young people get so frustrated because they're so anxious, and and it's interfering with their ability, say, to be able to do as well as, to perform as well as they think that they should be able to, or whatever. And so then they just do, instead of that flight thing and backing off and avoiding, then they do that fight thing. And that really creates some significant problems at school because we kind of know once children kind of get associated with a lot of aggression, that kind of acting out, disruptive kind of behavior, then sometimes it just makes it more difficult for people to want to kind of intervene in a positive way.
And you want your child's teacher to be your ally in this, but there is a parent-teacher road that has to be walked here, and you got to walk it together, and that can get very sticky sometimes. So when do you intercede? Let's say your child has anxiety, whether it's separation anxiety or it's the testing anxiety. When do you talk to that teacher? When's a good spot?
Well, I think that's some kind of communication that really needs to happen very early on. Sometimes children may, end up having negative attitudes from, staff associates because they see those behaviors, but they don't understand what's going on. When the parent has communicated and said, and kind of set the stage and explain to the teacher, these are the kinds, and then they see that child, I think, in a different light, in a more positive light, and really are appreciative that you have shared that information, because now maybe they can, better work with that child. Because what they also may do, if they themselves may not have what they think is the expertise to kind of know, what strategies to try in the classroom, then all of the schools have social workers, and they're probably school psychologists assigned to those particular schools, and so you have some behavioral health and nurses and so forth. So there are a number of health and behavioral health professionals there that can, be able to work with staff, to give teachers some tips that they might be able to use.
Because not all children learn the same way,
right.
And that can be a default that many schools, or a negative stereotype that many schools try to combat, is that you can't just sit there and teach students all the same way and expect them all to get it.
Right.
And you certainly don't want your child to be seen as a troublemaker when they are just having some trouble.
Right. And the other thing, and I was thinking about, you also, I think as parents sometimes, we have to remember too that each of our children is different.
Yeah.
And so, there are some children, because I can just think about it, I have 2 children. They're grown now, of course, but they were very different. And so, but sometimes we think, and we might say, not to be hurtful or anything like that, well, Johnny didn't do it like that.
Right.
He was always able to go and stand in front of the group, and but this child just may be a little different, and needs a little more attention, a little more
right.
encouragement, a little more opportunity, to be able to feel like he's got, and we recognize that there are children that no matter what situation you put them in, it seems like they excel.
Right, exactly. Yeah. You remember those kids in class, like they do great on everything.
Yeah.
What's the deal?
Exactly. Yeah. But then there are those that really need a little, nudging, a little, motivation, and so, kind of staying positive, and the other thing, rewarding, when I kind of praising attempts toward that. Sometimes we want the whole enchilada. Yes. So you need to get to the whole thing. I want you to be able to stand up and do that speech, by you. Well, but maybe he just got up and walked toward the stage. Good job.
That's a big step if you're scared to death to speak in public.
Exactly, because if you've been sitting back here and you refuse to go at all, then getting up to even go toward the stage is tremendous. And so that, as you mentioned earlier about building confidence, that's going to help do that, and it's going to relieve a lot of that, anxiety, and they're going to feel like, oh, this is possible, and so and so those thoughts, that are going on with them that are very negative, telling them, you can't do that, or this is going to be the worst thing. When you get up there, everybody's going to laugh at you, and because that's kind of some of what they're hearing. Yes. It's very, very detrimental, and so they're thinking this is going to be the worst thing that ever happens, but it's not. And so we need to be as encouraging as possible, about every little step. And I think we'll see some as parents, they will see some great movements toward getting to that end step that they would like to see if they start giving those little praise tips and incentives. Early on, it helps.
What about sharing your own experiences with your child? I imagine it has to deal with their age, how much they can really relate to that and take it to heart. Yeah. But do they listen or not? Because kids just like to tune out their parents. They don't, especially like my little ones, I don't think they ever thought I was a kid. They just think I'm mom, So does it make a difference?
Yeah, I think, they do. And we really do need to spend more time, talking to, I don't know if we can say this enough, but some commercials that talk about talking, communicating, put those cell phones down, put all this electronic stuff down, take some time and just be together, just be a family, kind of talk about some things that are going on. And also you want to say about school, you might want to ask some open-ended questions, how did that, for example, if they had a science fair, how did that science fair go today? You know, so that they can kind of tell you more about what really happens, as opposed to just being able to say yes, no, whatever. Right?
Yeah.
You want to communicate and you know, kind of find out, because you can also sense like how they were feeling and what did you do, and you know, because that they'll have to kind of talk about that. And I know we think that they don't want to say anything, but actually our kids really want a little more structure and a little more from us. Now, sometimes we have to work hard to get it sometimes, especially as they get older, because their friends become more important, of course. But you know, we just have to kind of catch those moments. You know, maybe we're in the room and we were kind of helping them get their room straight or so forth, and I need to put the pillow on the bed. You know, and so just some of those little opportunities, and they'll say, "Mom," yeah, but that's okay, you know, because you're communicating.
Yes, the dialogue,
you're communicating and so forth. And the other thing is too that sometimes we are kind of surprised at the topics that young people really want to talk about with us, and we're going, you know, where is this coming from?
I wasn't ready for this conversation.
but we're communicating, and so you know, it's a great start, and they know, it helps them know that you're there for them. You know, you're there to listen, and you're there to kind of you know, guide them. You know, be there for them. You know, you don't want to do it for them, and that's the other thing too. You know, when you think about anxiety disorders, you know, we don't want to totally eliminate it, because anxiety is just, I mean, it's a normal part of life.
Right.
And so we have to understand that stress just comes with living.
Life.
Yes. And so, but we all have to learn how to manage it appropriately. And I think in working with, you know, our young people, the way that we do, and kind of being there for them and that kind of thing, it gives them the opportunity, you know, to kind of see, well, it's not as bad as I thought it was, you know. So don't block. And I know sometimes as parents,
we just want to make everything perfect, you know.
But life isn't.
Right.
And so, you know, we want to make sure that when those situations arise, they're able to manage it on their own, and in working with them, you know, giving them opportunities to, you know, to practice, rehearse. You know, as we've mentioned, some kids are going to need that, whereas some kids, you just say, "See you later."
I was just watching this video on Facebook from a billionaire businesswoman, and she said growing up, her dad, at least once a week, as they were sitting around the dinner table, would say, "What have you failed at this week? Tell me what you failed at." And she would have to, you know, tell the story, like, "I tried out for this team and I was terrible." And he said, "Well, what did you learn? You know, what are you going to do differently?" And she said, "I learned so much more from my failures than I ever did my successes." And I think that we can all probably relate to that. But I thought, wow, as a parent, that is really an interesting perspective. You don't want to celebrate failing, you know, I guess, you know, all the time.
Yeah, no.
But you do want your children to experience that and then take it to the next step of, well, how did it make me better?
Exactly.
Yeah.
Well, actually, there's some, I kind of remember way back when studying for licensure exam, which is a long time, but still, actually, you know, in practicing, the strategy is that you not only focus on the correct answer, but you focus on the answers that are incorrect and why. Which is kind of a similar thing. And to be honest, just like that daughter, I learned more from focusing on why something was incorrect than I did focusing on, well, this is the correct answer, because really helped me to kind of think through the whole scenario, which otherwise I wouldn't have.
You're just looking for the right thing to check. Absolutely. Okay, on that deep thought, we're going to take a break, but when we come back, more about easing that back to school anxiety. We want to start these kids off on their best foot next week, so stick around. Welcome back to Open Line. Tonight we're talking about easing that back-to-school anxiety both for the student and the parents out there. Dr. Edwina Chappell with the Tennessee Department of Mental Health and Substance Abuse Services, that's a long title, is here helping us through it with some great tips. I want to kind of double back and put this on the screen. We talked about learning in different ways. I'm a visual learner, so I like to see tips, and that's what we're going to do. Parents should, over the next week and the first weeks of school, do these things, and it starts with just being patient and being prepared to listen. You got to pick up those little nuggets from your kids, right?
Exactly. And we talk about listening, doing that active listening kind of thing, so that you're really hearing what they're saying, and that they understand that, oh, Mom, Dad, they really heard me this time, as opposed to, and put things down. I think we want them to pay attention to us, so give them that eye contact.
Yes, they know when you're not paying attention.
Yes.
You also want to maintain consistent routines, but be flexible when you have to.
Right.
And it's not only getting ready for school, but the chores. You just need predictability.
Right. Well, I mean, it's that not knowing that we that's unexpected, that really kind of creates that stress, creates that anxiety. So if they've got a routine that says, okay, we're going to do homework you're going to do your homework every day after when you get home from school, and so that's kind of the standard. But maybe tonight, I mean, that's why you have to be allow flexibility, is that maybe something came up, and so there was a meeting, and so we weren't able to work on that together this time. But you have kind of prepared the person for that, your young person, so that he or she kind of knows. But you have kind of these standard things, and what some parents do too is like they'll have activities or rules or different things like that on kind of whiteboards or little magnets and different things like that to help, as you were mentioning, being a visual learner, so help kind of keeping things, and not expecting the child to only be the one to follow the rules, so that there should be things. So if we're asking, say for example, the child to make sure that he or she removes his or her plate, from the table when he or she finishes, then guess what? We need to remove ours too, that it's that it's not kind of that double standard.
Lead by example.
Right.
Also provide opportunities for practice and rehearsal. I remember going into middle school being freaked out about having a locker. It just, I was obsessed about it. I thought, well, what if I can't open the locker? What if I don't know where the locker is? It really made me anxious going into 6th grade.
Right.
So this is, and luckily I think my school had like a day where you come and practice your locker.
Right, exactly. And if you can, and I guess that's one thing, and some parents, I guess, will be able to go to the school ahead of time, be able to meet with staff ahead of time, so that they feel comfortable. The children would be able to go and kind of see what the environment would be like, so they won't be something that's, oh, well, this is, they have a nice look at things, and so when school day occurs, then they are just really ready. Oh, I know where I'm going, and they think they're kind of ahead of
But this
things.
could be the same for, if the ACT is coming up and you have a child with testing anxiety. There are all those practice forums on the internet, and you say, okay, today's ACT day at home. We're going to practice like it's the real thing.
Exactly.
And get used to it.
Exactly. But again, those things, maybe don't do it just one time, so provide several opportunities, especially, if somebody is kind of, say struggling with certain kinds of things. Maybe it's, being able to, to talk to someone that's new. So, you might want to give them several opportunities, along the way, as you go forward. So don't think that just one night or two is going to
fix it.
Yes.
Yeah. And then the last tip is just praise and reinforce the effort, even if it's not the A+ or the perfect score, or they detached from you immediately when you got to school.
Exactly. And sometimes, especially when our young people get in high school, sometimes that really becomes an issue, because what are we thinking about? College, and that kind of thing. But we have to kind of remember that these are still young persons. They're still growing, they're still developing. Their brain brain isn't fully developed yet at that particular time, and so and they really do. They feed up just like we do. They feed off of praise and support. And we might think that because we're the parents giving to them that they aren't, but they really do appreciate it a whole lot. And and reinforcing when they get in. So, and you're building that confidence. So they'll be willing to maybe take that next step. And so I'm not as anxious now as I was. I can at least move to this level. Right.
Let's also talk quickly about what schools can do, because they are your partner in this. They first of all need to reduce the unexpected situations.
Exactly.
What does that mean from a school perspective?
Well, I was thinking along the lines, how even on our jobs now, how often are we notified when the fire drill is going to occur?
Never.
Well, well, I was getting ready to say this. We are.
You are?
We are.
Wow.
Okay, but if you think about that, it really is helpful, because then when it occurs, then I'm not as anxious. I'm not as stressed about it. So if schools kind of let the young people know, okay, or sometimes this week we're going to have a fire drill. So when that happens, then young people don't get. So it's kind of that kind of thing. Just knowing, kind of having an idea of what's going to happen. You may not have the exact time, but they have a frame to work from. Exactly. Yeah.
Also, pair anxious students with peers who are more confident and supportive.
And I think a lot of schools have moved kind of to a buddy type system, especially when you're looking at the possibility of new students coming into school, so that they will have a buddy to go with you to the cafeteria, even a buddy in your classroom, a buddy to walk with you to your different classes and so forth. So you can kind of know where things are. I keep wondering, how in the world do we find how to get around? But there are many more children in schools now than probably when in our particular schools and so forth. So it's really very helpful for them to help us, and then it makes that young person feel, and they feel special as well.
That's a good point.
Yeah,
and they have someone they can rely on next to them. And then also it can help to move a student to a quiet setting, fewer distractions. You said a lot of this may develop or at least appear as ADHD. So having just a quieter environment, letting them relax, right?
Yeah, because all those thoughts, those anxious thoughts that are going in through the head, they are just really
they can be loud.
Kind of they're really clouding up things for that young person. And so sometimes just kind of setting them somewhere, and maybe it's they're going to be somewhere where they can view, maybe on a computer, a nice nature scene.
Oh, that's nice.
And something that simple, and that will kind of minimize and reduce, the stress levels for them, and kind of help them refocus and, kind of reframe and maybe, be successful at what they were trying to accomplish at that point.
And you made a good point. We're going to put up a couple of websites that folks can check out here in a second. You said off your website, more people are downloading the tips and information regarding to disruptive behavior rather than anxiety disorders. And that's kind of just reinforcing the fact that maybe a lot of folks are skipping the, it's really just an anxiety order.
And it's just amazing how we see some of these behaviors kind of playing out in ways that we didn't expect them to play out, and some of that, of course, is in some of the acting out behaviors that we have. And again, I think we talked about, for some of the young people who are doing more avoiding, more isolating themselves, kind of pulling back, and they don't really have many friends, that kind of thing, then what can happen if anxiety goes untreated in those cases is it can possibly lead to depression.
And nobody wants that for their child.
Exactly. So, seeking help there, a lot of different resources. Sometimes schools have information that they can share with parents about possible practitioners, whether it be private practitioners or whether it be community mental health centers, that kind of thing. So usually there are quite a few resources, and especially in this metro Nashville area, I think that we can find quite a few persons who have some experience working with children and adolescents, and actually have an interest and some training in anxiety disorders with children.
And is this something that you often see success in once children seek that, or the parents seek the help for their child?
Yes.
That there is success.
Yes, and because actually I think the highest recommended treatment is cognitive behavioral therapy. It's a lot of that self-talk kind of thing, and it's those intrusive thoughts that kind of get away and have us at the very high level. So.
All right, we're going to take a quick break. When we come back, much more. Stick ahead. I want to thank Dr. Edwina Chappell for being here, facing your own anxiety about being on TV. I get it. I certainly do, and some great tips, so we appreciate that. Want to put up your website real quick where folks can find out more information if they want to get the information on anxiety disorders. This can really be helpful right here, this website, right? Big document.
Yeah. The helpful link is directly to our anxiety disorders best practice guidelines, but if they search the website, they can find our total document, which is best practice guidelines for children and adolescents from birth through 17 years of age.
That'll cover it. Thank you for being here.
Okay.
Thank you for being with us tonight. Hope you guys have a great first day back to school next week.